is Lucia Ava Dale. She's 7 months old.
It kind of fit her, Lucia Ava. We were trying to find a name that would work both in Spanish and in English.
They play with their hands, or they hold something and they turn it back and forth, and you want to know so badly what they're thinking.
I love her head. Oh, do I love this head. I kiss it all the time.
Now, I tell some people that I think that take all the other things that you might love in life and you add them all together.
It's the most amazing, amazing thing I've ever done, but it is the hardest thing I've ever done.
It's never easy to hear them cry, because you know that they're unhappy, and that's the way that they communicate with you.
I think we don't really hear enough that babies cry, and they cry more than we think they do. That can be frustrating. I think there's a thought there that if a baby's crying, maybe we're not doing something right.
Well, the easy things they might be trying to say is, I'm hungry, I'm tired, I'm wet, I have a poopy diaper, or I just don't know what's wrong with me, so it's the only way I can talk to you right now, because I don't have language, and my language is crying. Crying could also be a sign of illness, so a baby might be sick. For example, have a fever, have an ear infection, have the flu.
They can always call their primary care provider, call their doctor, maybe make an appointment and make sure their baby's okay.
Even 20 minutes can seem like a long time for a baby to be crying.
If you total the amount of crying that a baby can do, it can be pretty significant. Several hours of crying every day.
I would check the baby's diaper, maybe take a temperature and see if the baby is sick. I would swaddle the baby tightly and offer the baby a binky, maybe try to feed the baby, see if the baby's hungry, burp the baby. Sometimes babies like to go for car rides, so put the baby in the car seat and go for a little drive, see if that helps.
So everybody has the feelings. Everybody is capable of having those feelings of frustration or anger even, but you just need to know how to deal with those feelings.
Unfortunately, crying can lead to periods of overwhelming frustration, overwhelming anxiety.
For me, it was important to kind of identify when you're frustrated, and you know, just to not let yourself kind of feel anger or anything like that.
You can think that you understand it, but until you're in the situation with your screaming baby at 2 in the morning and you're doing everything you can.
It's completely normal to feel, isolated, or to feel like you're the only parent out there who doesn't know how to make their baby stop crying.
And sometimes frustration and not knowing what to do crosses into this area where they lash out against a child or a baby. Shaken baby syndrome is a term that we've used in pediatrics for many decades to describe a pattern of injuries that can occur within the baby's brain when a baby or a very young child is picked up and shaken very violently, or unfortunately, it sounds very graphic, but also the baby or young child is thrown down very violently or aggressively.
Some of my patients that have been shaken are in the hospital because they stopped breathing. They started having seizures. Many of them will have difficulty swallowing or eating with their mouth. Some of them, the damage can be so severe that they won't talk, they won't walk.
There are many things we do with babies and kids that would not cause this injury, and that's bouncing them playfully on your knee. Bring around the rosy with an older kid. Rocking them in their swing to help them go to sleep. That's not the type of injury that we're talking about. Young babies have big heads, and their neck muscles are very weak. So their neck muscles aren't developed yet. They don't have the tone to be able to hold themselves up yet. The peak age where crying occurs and when shaken baby syndrome occurs is around 2, 4, 6 months, where they haven't developed that kind of strength yet. Their brain is very new. It's just started to grow and to develop. It doesn't have a lot of structure to it yet. So when the baby's head moves violently, when they're shaken or thrown down, that brain is susceptible. that neck muscle is susceptible to injury.
It's pretty common that I would have maybe one baby that has been shaken on the floor at the hospital here at all times.
The best estimate nationally is about 1,200 to 1,400 cases a year of this form of physical abuse of children. And those are the babies that can have very bad outcomes, such as cerebral palsy, so motor difficulties, they won't be able to move very well or all, blindness, deafness, developmental disability or developmental delay, they won't be able to learn normally and grow normally and process information and learn like other children.
Be brave and have that conversation. Talk with your caregivers, talk with your spouses, come up with a plan. Know that babies cry and know what you're going to do when they do cry.
We've got daytimers, we've got pump outs, we've got blackberries. So we have plans for everything in our lives.
Maybe I would call like our friend Jen or our Aunt Becky, and maybe ahead of time say, if we have too many problems, just call right away and just say, can you help out, do whatever. You need to be aware you're going to need help one way or the other.
If you feel that you've done everything and you are at your wit's end, or you are so frustrated and you don't know what to do and the baby won't stop crying, softly, gently put the baby down.
A crying baby can never hurt itself. So put them down and walk away.
This is just another part of your plan for how to take care of your baby or your child. It makes it easier to have that conversation, I think, with one, the doctor, two, your babysitter or your other caregiver, and more importantly, yourself.
When you take your baby to a caregiver, it's very important for you to take, the steps necessary to make sure your baby's well cared for while you're gone, while you're not with her. But then also just to ask the caregiver directly, how will you react into this type of situation? And make sure you're comfortable with the response that they give.
It's not going to make me feel uncomfortable, or I'm not going to feel like they're, accusing me of, shaking babies or of, leaving babies crying. I think it just makes them, that much, better of a parent, a stronger parent. I expect them to ask those kinds of questions.
Understand that that plan is something that doesn't just stop when the baby's stopped crying. You revisit what you're going to do when you're in that situation again, and you communicate, this is my plan of how I'm going to approach crying and how to take care of it with everybody that takes care of your baby. This is a form of child abuse. This is an abusive, violent thing that unfortunately does happen. We can prevent this. This is the most preventable form of abuse. We know what the cause and effect is.
I think it's human that people get to a place of being overwhelmed, stopping and making sure the baby's safe and just taking a deep breath, stepping back, is vital. It's that point of recognizing I'm frustrated and I just need to be somewhere else for a minute. That could maybe stop shaken baby syndrome.
For helpful tips on coping with crying and how to soothe a crying baby, visit calmacryingbaby.org.